everyone. You're watching Eagle News America. I'm Thomas I. Likeness, broadcasting from our studio in Edmonton, Canada. December 28th, 2020. Only about 3 more sleeps until New Year's Eve. In the news, we have updates from several of our correspondents across North and Central America. May Davila in Ciudad de Panama reports on the latest restrictions in that country, including a total quarantine on weekends. Mayan Manzano-Gerzin in Sicklerville, New Jersey.
Long-term care facilities in New Jersey begin COVID-19 vaccination.
Mila Simbulin in Swarthmore, Pennsylvania.
Same here, Thomas, in Pennsylvania. Pfizer BioNTech COVID-19 vaccine for Pennsylvania's long-term care facilities.
Philip Toledo in Atlanta, Georgia, updates us on vaccine distribution in that state. Anna Cui in Las Vegas tells us that antibody therapy for COVID-19 now available in Nevada, but who picks up the tab for that treatment? Liza Gonzalez-Manglikmot will tell us about D.C. residents being invited to kick off the new year in the Fresh Start 5K. This year, though, it's going to be virtual. From the business desk, we'll hear from Nicole Adeline Padilla in Baton Rouge, Louisiana, who tells us about Amazon's plans to build a fulfillment center there. Plus, for tonight's virtual roundtable, it's National Short Film Day. We'll talk about our favorite short films and what we think about them. Our coverage begins now. First, an overview of how COVID-19 looks now. According to the Coronavirus Resource Center of Johns Hopkins University in Medicine, as of 6 p.m. Eastern Time today, the number of cases of COVID-19 reported worldwide, more than 80,979,000. Top 3 on the list of countries with recorded cases: the United States, 19.1 million, India, 10.2 million, Brazil, 7.4 million. And sadly, more than 1,768,000 lives worldwide have been lost to this virus. The top 3 countries with the most number of COVID-19 related deaths: the United States, more than 333,000, Brazil, more than 191,000, and India, more than 147,000. Well, it took a week and a lot of pressure from all sides, but finally, last night, President Donald Trump ended the drama and he signed the $900 billion COVID relief bill. Now, the package includes a $600 payment to Americans and extensions on unemployment benefits. As well, it extends the moratorium on evictions, and it avoids a shutdown of the federal government. Trump finally caved days after he lambasted the package. He hinted he would veto it. Wall Street reacted quickly this morning. Stocks rose to record territory. Both the Dow and S&P 500 up 0.7%. The Nasdaq advanced 0.6%. Meanwhile, for the president, it's another day of golf. Trump's motorcade departed for his golf club in West Palm Beach, Florida this morning. He spent most of the holiday weekend on the links. In Nashville, Tennessee, investigators trying to determine the motive behind an explosion Friday that ripped through part of the city's downtown. 3 people suffered injuries after a motorhome parked on a downtown street exploded. At least 41 businesses in the country music capital were damaged. That is security footage of the blast. Some historic buildings may have to be torn down because of structural damage. Federal prosecutor Don Cochran says the suspect has been identified.
Based on the evidence that we've gathered at this point, we've come to the conclusion that an individual named Anthony Warner is the bomber, that he was present when the bomb went off, and that he perished in the bombing. We base this conclusion on forensic evidence, including DNA evidence that you'll hear about, as well as evidence that was gathered at the scene of the bombing.
FBI Special Agent Doug Koreski says it's believed the suspect, Anthony Warner, acted alone.
We're still following leads, but right now there is no indication that any other persons were involved. We've reviewed hours of security video surrounding the recreational vehicle, as well as we saw no other people involved. or around that vehicle.
Tennessee Governor Bill Lee has asked President Donald Trump to declare a state of emergency. That's so the state can get federal assistance to repair the damage. Well, how long should you wear a disposable face mask before throwing it out? You know, face masks require frequent rotations to remain effective, but little attention has been given to whether people change them regularly enough. Engineer Graham Skinner with the Scottish company Insignia Technologies says, well, they've come up with a way to let you know when it's time to say goodbye to the mask you're wearing.
We've developed this innovative colour-changing technology, which is transformed into colour-changing labels, and we believe these labels can then be used on face masks in order to remind people, educate them on how long they should be wearing them.
The labels are yellow to begin with, and then they gradually turn blue as they deteriorate in effectiveness. The color change process can take 4 to 6 hours. The labels can be used on disposable or reusable masks. Fake steak, counterfeit chicken, manufactured meat. Several of the names you can come up with for a product food scientists have been working on. They use the more cultured term. They call it cultured meat. Now, this stuff is grown in a lab and made a historic debut recently at an upscale restaurant in Singapore. Creators of this grub say it could help reduce the environmental damage involved in human food production. This lab-grown chicken meat was made by U.S. startup Eat Just. The product has been approved for sale in Singapore. Singapore, incidentally, is the first country to allow the sale of meat created without slaughtering any animals. It's on the menu at the 1880 Club. So, what do diners think of it?
It's a bit weird, and I think I will not be trying it. Yeah, because I prefer the real thing.
There would have to be a lot of research provided on it before I would do that.
Right, okay.
I mean, I've heard of other lab-grown things. I mean, my father worked with lab-grown gems back in the day, but that's a little different than food, so
Okay.
I'm not discounting it, but I would need to see the research. I think that people should start leaning more towards vegetarianism, veganism, more than trying to replicate things in a lab. I think it's better to stay with natural products and plant-based products than try to play God in a petri dish.
I don't think I'd try it either. Me, I like my steak, a real one, grilled blue rare. Up next, reports from Ciudad de Panama, Sicklerville, New Jersey, and Swarthmore, Pennsylvania. Eagle News America continues.
Events happen around us all the time, in our community, in our country, around the world. Events that affect people, move communities, or simply inspire us. Interesting events that people need to know. In these interesting times, we continue to be a competent partner in delivering news about these events. Fast, accurate, balanced. Eagle News, because we live in interesting times.
Napakagaling mong kumanta.
I like your voice. Napaka-rare ng quality ng voice mo. Masyadong mataas, masyadong maganda.
Ito na lang masabi ko, good luck.
Ang gagaling ninyo. Grabe yung mga pinakita nyo sa amin. Sobrang gifted kayo.
I must say, it's one of the best round na napanood ko.
watching Eagle News America. I'm Thomas I. Likeness. In the Central American country of Panama, the government tightening things up. There are quarantines on the weekend now, and other restrictions too, restrictions by gender and identity number. Eagle News correspondent May Davila explains.
Given the increase in infections and deaths from COVID-19, and with the aim of stopping the chain of transmission of the disease, the Ministerio de Salud announces that from January 4 to January 14, there will be a total quarantine. This means all businesses will be closed except for essential services, and a curfew from 8 p.m. to 5 a.m. will be implemented for the provinces of Panama and Panama Oeste. With this decision, at least 2.2 million people residing in Panama and Panama Oeste will have to face total confinement. During the total quarantine, people will only be allowed to go out to make purchases exclusively of food and medicine in supermarkets, grocery stores, and pharmacies. They will also open hardware stores, clinics, veterinarians, fuel stations, and other essential services. This allowed establishments will work only until 7:30 p.m. Purchases will be made according to the day that corresponds to gender, and departure time will be according to the last number of the person's cedula or passport. This is to reduce at least half of the people who frequent the streets, neighborhoods, and shops. Each person will have a period of 2 hours to leave their home, make their essential purchases, and return home. Only women can be out Mondays, Wednesdays, and Fridays, while men can only on Tuesdays and Thursdays. All adults over 60 and people with disabilities, regardless of their cedula number, can go shopping only between 11 a.m. and 1 p.m. The sanitary fences between provinces will remain in effect from January 4 at 5 a.m. to January 14 at 5 a.m. The health authorities decided to maintain the measures previously announced from December 28 to 31, which governs the full working day throughout the country. During these days, the curfew continues at 7 at night. Shopping in stores is allowed by gender. Women on Mondays and Wednesdays and men on Tuesdays and Thursdays. Stores must be closed at 5 p.m. to allow staff to arrive home before the 7 p.m. curfew. From December 31 to January 4, 2021, the total quarantine is maintained throughout the national territory. The total quarantine will start from Thursday, December 31 at 7 p.m. to January 4 at 5 a.m. Minister Luis Francisco Sucre says the new measures announced were given because the speed and the number of infections has increased this December. The government seeks to prevent the number of active cases from exceeding hospital capacity. Sucre said that these measures will serve to reduce the speed of contagion only if everyone will follow the biosafety measures and the restrictions established by the government. Desde Ciudad de Panama, May Davila, Eagle News. Vivimos en tiempos interesantes.
Good news for people living and working in New Jersey's long-term care facilities. Eagle News correspondent Mayanne Manzano-Garrison joins us live to tell us about the vaccination programs in these venues. Good evening, Mayanne. Thanks for joining us.
Thank you, Thomas. Now, in a report released by the Office of New Jersey Governor Phil Murphy, joined by New Jersey Department of Health Commissioner Judith Percy Kelly and CVS Health Regional Director Kat Kingston today, visited Roosevelt Care Center in Old Bridge to mark the launch of New Jersey's vaccination effort of residents and staff of long-term care facilities. The vaccinations are being administered pursuant to the Federal Pharmacy Partnership for Long-Term Care Program, a partnership between the Centers for Disease Control, CVS, and Walgreens to facilitate on-site COVID-19 vaccination services. Through the Federal Pharmacy Partnership for Long-Term Care Program, New Jersey already has 291 long-term care facilities scheduled, and over 83,000 residents and staff is slated to receive vaccinations through the beginning of February 2021, with more sites to be added in the coming weeks. Take a look.
What we're witnessing here in New Jersey is happening in dozens of other states across the nation. Long-term care facilities across the entire nation, and certainly here, have been crushed by COVID-19. They have borne an outsized burden of this pandemic. And as I have said many times, and by the way, many times with Judy right by my side, while we know we're not alone given the toll on long-term care residents and staff nationwide, we're not going to just sit back and be part of the pack. We're going to break out, move forward, and provide solutions that can serve as national models. We have implemented, both through direct action and in partnership with our legislative partners, thank you, Sam, and your colleagues, countless short, medium, and long-term solutions to the systemic shortcomings this pandemic has exposed and laid bare. Our goal has consistently been to not just meet the current challenges, but to ensure both high-quality care and the safety of residents and staff going forward. And that is why seeing these vaccines being administered here today is such a tremendous moment. It is a big step toward that goal. So vaccination is not just about ending this pandemic. It's a step toward a stronger and more resilient future. It's a step toward allowing the residents here to once again be able to see and hold their loved ones. And that day will come. But right now our focus remains squarely on the task ahead. The task of vaccinating our most vulnerable residents here and in other long-term care and congregate living facilities. While we undertake this process, it is on all of us to continue doing the basics, the practices that we know are the only ways short of safe and effective vaccines to slow and stop the spread. And you know what they are: social distancing, wearing our masks, washing our hands with soap and water, using common sense. Let there be no doubt, as our vaccine program unfolds and as millions of New Jerseyans become eligible for vaccination, and as they step forward and roll up their sleeves, as the folks here at the Roosevelt Care Center are, we get closer to defeating this virus. Over the past 9 months, our state has paid a tremendous price. We have gone through some dark times together as one New Jersey family, but the light is starting to break on the horizon, and our fight to end this pandemic is just starting to kick into its highest gear yet.
And Thomas, for some weather update, it's currently 8:57 in the evening here in New Jersey, and it's currently clear. It is now 39 degrees Fahrenheit or 4 degrees Celsius. The high today was forecast as 52 degrees Fahrenheit or 11 degrees Celsius, and the low tonight will be 30 degrees Fahrenheit or -1 degrees Celsius. In Sicklerville, New Jersey, May and Manzano Garzon, Eagle News. We live in interesting times. Back to you, Thomas.
You know, compared to where I am here, that weather still sounds good. We're below zero. Here is feeling like about -12 with the wind and so on. I'm curious, though, Mayanne, how big a hit is this vaccination program with the residents of the Roosevelt Care Center? Did most of them sign up for it?
Well, Thomas, all but 20 of the residents of Roosevelt Care Center signed up for the vaccine, and authorities are still hoping, Tom, that the rest would follow once they see that the vaccine is safe. Thomas?
Okay, what now is the next step for other long-term care facilities?
Well, Thomas, the next step, according to the authorities, the state officials, is to set up 6 giant vaccination sites along with 200 satellite sites with staff to administer the vaccine and technology to track the patients. Thomas?
That's going to be a big project. Thanks for joining us this evening, Mayanne, and you stay safe.
Thank you, Tom. You too.
Much the same in Pennsylvania as we just heard about in New Jersey. Long-term care facilities there have been given priority on the vaccine distribution list. Eagle News correspondent Mila Simbulan is standing by with the details. Good evening, Mila.
Hi, Thomas. That's right. As directed by the CDC, COVID-19 vaccination through the Federal Pharmacy Partnership, or FPP, starts today with skilled nursing facilities. Here's Dr. Rachel Levine to tell us more. Take a look.
As you know, today starts the Federal Pharmacy Partnership to vaccinate residents and staff of long-term care facilities. Walgreens and CVS are the 2 pharmacy partners selected by the federal government. CVS, and Walgreens have vaccine leads that are reaching out to the assigned contacts at each facility. These points of contact coordinate information such as setting the date, receiving additional information on bed count, employee count, and coordinating patient consent. In the first weeks, the partnership will be vaccinating residents and staff in skilled nursing facilities, often what we call nursing homes. It will then move to vaccinate other long-term care facilities, such as personal care homes, assisted living facilities, residential treatment facilities for adults, and private intermediate care facilities for individuals with developmental disabilities.
The federal government has established the Federal Pharmacy Partnership, or FPP, program for long-term care facilities in order to help vaccinate one of the highest risk populations, those who live and work in long-term care facilities, or LTCFs. This program will provide vaccine directly to the pharmacy partners that will handle all parts of LTCF vaccination process. The Pennsylvania Department of Health and the Philadelphia Department of Public Health have both opted to participate in this program. This means that a significant number of LTCFs were automatically enrolled in the program and given the option to pick a partner. Recently enrolled facilities were given a partner based on location, and the department continues to work to enroll additional types of facilities. In Pennsylvania, CVS and Walgreens are the two FPP participants. Each partnership will report data on those vaccinated in Pennsylvania, minus Philadelphia, through the Pennsylvania State Immunization Information System, or PASIIS. Philadelphia uses its own immunization registration system. Meanwhile, here's the current status of COVID-19 cases here in Pennsylvania. The state has seen a 7-day case increase of 46,777 cases. The previous 7-day increase was 57,098 cases, indicating 10,321 fewer new cases across the state over the past week compared to the previous week. The statewide percent positivity went down to 15.1% from 15.82% last week. Each county in the state has a concerning percent positivity above 5%. This includes 19 counties with percent positivity at or above 20%. Hoping that all these numbers will continue to decrease, Thomas. Currently, Swarthmore is 42 degrees Fahrenheit, which is equivalent to 5 degrees Celsius. In Swarthmore, Pennsylvania, Mila Simbula and Eagle News, we live in interesting times. Back to you, Thomas.
Maybe I'll move to Pennsylvania. That's even warmer than New Jersey. Before you go, I just want to ask you off the top of your head, from what you hear on the street and so on, what's the reaction to the vaccine? A lot of people anxious to get it, or are they sort of taking a wait-and-see attitude?
It's a mixed reaction, Thomas. Some are excited to get it, especially the healthcare workers, on those frontline workers, but others, especially those that have children, they still wanted to wait a little bit more to see and find out, what's their reaction of other people having all this vaccine. Thomas?
And I hear there's a third one coming, expected to be approved in the next couple of weeks, early January, I understand. That's the one from AstraZeneca, I believe it is.
And Johnson & Johnson as well, yes.
Right. So there should be some good choices out there. Thank you for joining us this evening, Mila, and take care.
Thank you. You too, Thomas.
Thank you. Still to come, our correspondents will bring you stories from Las Vegas, Nevada, Atlanta, Georgia, and the nation's capital, Washington, D.C. This is Eagle News America.
It's time to sing!
It's time to eat!
Hindi nga, it's time to sing na nga.
Hindi, it's time to eat!
Kantahan nga ito kantahan to.
Kainan to.
O sige, ganito na lang. Para magkasundo tayo.
It's
singing time!
It's singing time! Mula Lunes
Lunes hanggang Biyernes, alas 8 hanggang alas 9 ng gabi. Magsisimula na sa January 4, dito lang sa Net25.
Factual.
We have to defeat the virus everywhere.
Timely information. Balanced, not only in the country, but also abroad.
I'm certain of one thing.
Interviews that people need to know. Watch Aguila Pilipinas! A one-hour newscast of reports coming from regional hubs in Luzon, Visayas, and Mindanao. Know the important updates in Asia in ASEAN in Focus. Track the latest stories in the provinces in Aguila Provincia. Tune into Mata ng Aguila, the evening primetime news program of Net25. Balanced and objective, Mata ng Aguila covers national and international issues, tackles news on business, health, science and technology, entertainment, sports and human interest features, and current events. And Eagle News International delivers the latest global reports, impartial, accessible, and up-to-date. It brings to fore EBC's rich international scope and access to valuable information streams.
Well, thank you to Explain our Health Outdoor.
Catch these programs on Net25. You can also watch our news programs through eaglenews.ph and Eagle News Facebook page and YouTube channel.
You're watching Eagle News America. I'm Thomas I. Likeness. Antibody therapy to treat COVID-19 now available in Las Vegas. The million-dollar question is, who's going to pay for it? Joining me now from Vegas is Eagle News correspondent Anna Cui. Anna, is it going to cost $1 million?
Not quite $1 million, Thomas. Thank you. Now, yes, remember one of the treatments that President Trump received when he tested positive for COVID-19 back in October, it is the monoclonal antibody therapy, which at the time was not yet available in the market. But since then, the FDA has recently given their approval for drugs made by Regeneron, which are the casirivimab and imdemivab, and Eli Lilly's benlanivimab as treatment against COVID-19 under its emergency use provision. Good news, as you mentioned, it is now available here in Las Vegas, specifically at the ER at Blue Diamond, which is part of the Valley Health Systems. According to a release statement, Dr. Patrick Olivieri, the medical director of the facility, the goal of the therapy is to help temper symptoms, prevent hospitalizations, and reduce mortality and morbidity. He also explained, and I quote, "This is a safe infusion of antibodies that will directly attack the virus before your body has fully made its own antibodies." Now, according to the FDA, these monoclonal antibody therapy is not authorized for use in patients who are already hospitalized due to COVID-19 and those who require oxygen therapy, as it may be associated with worse clinical outcomes for these type of patients. Now, as you mentioned, the question is, who pays for it? Because the drug itself costs more than $1,000. I believe I read it was like $1,350, and that's not including, of course, the facility fee for the ER, and of course those who will administer it. Well, according to Medicare.gov, the patient pays nothing for this treatment during the COVID-19 public health emergency when you get the treatment from a Medicare provider or supplier. In addition, you have to meet the following guidelines. First, you must have tested positive for COVID-19. You have to have mild to moderate symptoms, and you are at high risk of progressing to a severe case of the COVID-19 and or high risk of requiring hospitalization. FDA's criteria for high risk include BMI, body mass index greater than 35%, someone with diabetes, someone with chronic kidney disease, and of course, someone with a immunosuppressive disease. On a side note, it's also indicated for children 12 to 17 years old, but with much more stricter guidelines. So the thing to remember here is, Medicare, if you have Medicare coverage, it will be covered. But for those with commercial insurance plans, the Aetna, the Cigna, it is best to call your insurance beforehand and ask if they are included in that federal funding, how much they would pay for it, and how much will be your share. So how does this process really work, Thomas? According to a staff at the ER at Blue Diamond I called today, the patient must bring in proof of positive COVID tests along with a doctor's order or referral. So it is then scheduled as an outpatient procedure. So you can't just walk in and expect to get it because, there's coordination behind that has to happen. The infusion itself takes about an hour, and then they require the patient to stay for another hour for observation. The side effects are typically limited to a rash or itchiness, as stated by Dr. Olivieri. Now, before I let you go, Thomas, since we're updating with our weather, the weather here in Las Vegas today is currently at 42 degrees or 8 degrees Celsius. In Las Vegas and Anaheim, Eagle News, we live in interesting times. Back to you, Thomas.
Okay, the desert state wins. That's where I'm moving. It's the warmest there. I'm curious a couple of things about the antibody therapy. First of all, I'm not sure whether how familiar you are with it. Does it just require a single dose, or would it require multiple doses?
Yes, it only requires a single dose. With the Regeneron, it's 2 different drugs, and then with the Eli Lilly, it's only 1 drug. But it is just one time dose.
About a $1,000 price tag on that. What are your thoughts about this antibody therapy?
I think it could really be helpful to, the patients who meet the criteria. The only thing is, I think, this is just my opinion, is because of the news of the vaccine, the news for this therapy kind of got put on the wayside. Because everybody's now looking forward to the vaccine. But we have to remember, the vaccine, again, it's going to take some time for it to really make a difference. As we mentioned in the past, a good percentage of the population has to be vaccinated, right, before we can see a change. And in the meantime, there is this effective treatment. It's working according to the data. Of course, it's still on emergency use. And it's just a matter of providing the information to the public. Where can they get it? I looked into it in Las Vegas, and the only place that I found is that Valley Health Systems. Right now, I believe the dosages the supply is limited. I read Eli Lilly can only produce, the government actually only purchased 300,000 doses, and that's not enough, obviously. Thomas?
You pointed out something very important here. We have to take a two-pronged approach to this pandemic. Yes, the vaccine is important, but the vaccine is preventative. We still have people who are ill, people who are going to be ill. So that's why the treatment is very important as well. And certainly this is one of the tools in the toolbox.
Exactly. And of course, Thomas, we have to continue. Again, we have to remind everybody to continue with the safety measures. Even if, even if you've had the vaccine, you still have to continue wearing your mask, observing the social distancing, and limiting your outdoor activities. Thomas?
Oh, that's the ultimate prevention. Thank you for joining us this evening, Anna, and stay safe. We go to the state of Georgia now. Health authorities there distributing some 300,000 doses of the COVID-19 vaccine. Eagle News correspondent Philip Toledo brings us up to date on the governor's distribution plans.
Thanks, Thomas. As COVID cases continue to surge across the nation, the state of Georgia is no exception. The Georgia Department of Public Health today is reporting a total confirmed case count of a little less than 550,000. And the COVID-related deaths are now at just about 9,700. New cases are definitely surging, with our average daily new case count nearing the same as it was during the previous peak this past summer. Now, today, Governor Brian Kemp held a press conference to update the state on the COVID vaccine distribution. Right now, in Georgia, vaccines are being targeted at frontline medical workers, those in clinical settings, and the governor announced today that residents of long-term care facilities are now starting to receive it. According to the Department of Health vaccine dashboard, 26,000 Georgians have already received the vaccine, and almost 300,000 doses of the vaccine have been allocated to the state so far. Now, to help combat misinformation that is spreading about the vaccine, particularly online, Public Health Commissioner Dr. Kathleen Toomey also announced today a new call center for Georgians to call if they have questions about the vaccine. Now, if you live in Georgia and you have questions, you can call 1-888-357-0169, or you can visit dph.georgia.gov for more information. Now, we went to the website ourselves and browsed around, and it does include a very helpful FAQ section, as well as more detailed plans for distributing the vaccine. Now, according to those plans, we're currently in Phase 1A here in Georgia, which focuses, as I mentioned earlier, on those frontline healthcare workers and long-term care facility residents. Now, when we get more of the vaccine, we'll move into Phase 1B. Phase 1B will focus on police and fire personnel, critical workforce employees, which would include your teachers, food processors, grocery store workers, and the like, as well as adults that are age 65 and older with comorbidities and their caregivers. Now, on his social media accounts summarizing the press conference, Governor Kemp encouraged all Georgians to, quote, hunker down and follow prevention measures, as we're all waiting for the vaccine to be more widely available. And with cases on the rise, Georgians and all of us are reminded to wear a mask, wash your hands, keep your distance from others, and follow the guidance of public health officials. Now, wherever you are, we hope that you're staying healthy and you're staying safe. In Atlanta, Georgia, I'm Philip Toledo, Eagle News. We live in interesting times. Back to you, Thomas.
Thank you, Philip, and stay safe. Life, of course, different because of the pandemic, no doubt about that. Some traditions have been set aside this year. Others have been modified. As Eagle News correspondent Eliza Gonzalez-Manglicmot tells us, city residents will continue to ring in the new year in Washington, D.C. with the annual Fresh Start 5K, but there will be changes this year.
Thank you, Thomas. DC Mayor Muriel Bowser invites residents of the district to celebrate the new year at the 7th annual #FitDC Fresh Start 5K to be held virtually for the first time. Due to pandemic restrictions, instead of gathering at one location, residents are given options where to run. 1, they could be in their neighborhoods. 2, at a DC public school or DCPS. 3, at a Department of Parks and Recreation track. Or number 4, along a suggested route available through the sign-up portal. Residents can register online and track their run time through the online portal to compare and connect with family and friends. A free #FitDC Fresh Start t-shirt and medal are available at select DPR recreation centers in the days leading up to the 5K for participants who register. Now, Mayor Bowser said the passing year, 2020, was all about finding new ways to stay connected, and now the district is keeping one of its favorite traditions going by making it virtual. The mayor also mentioned with the arrival of a safe and effective vaccine, 2021 presents a renewed sense of hope and a commitment to work together to finally end the pandemic. She said starting the new year with a 5K is the perfect way to kick off a healthier 2021. And so she invites district residents to mask up, social distance, and pick a spot for this virtual 5K. #FitDC Fresh Start 5K partners include Aetna, DPR, Vida Fitness, Pacers Running, and various running groups from across the district. Before, during, and after their run or walk, residents are encouraged to tag at MyFitDC and use the #FreshStart5K2021. The event is this Friday, January 1, 2021, from 8 a.m. to 4 p.m. Locations include DCPS and DPR track locations and neighborhood routes. For Ward 1, it's at the Banneker Recreation Center at 2500 Georgia Avenue Northwest, and at the Cardozo Education Campus at 1200 Clifton Street Northwest. For Ward 2, Stead Recreation Center at 1625 P Street Northwest. For Ward 3, Palisades Community Center at 5200 Sherrier Place Northwest. Woodrow Wilson High School at 3950 Chesapeake Street Northwest. Ward 4, Coolidge High School at 6315 5th Street Northwest. And at Roosevelt High School at 4301 13th Street Northwest. For Ward 5, it's at the Turkey Thicket Recreation Center at 1100 Michigan Avenue Northeast, and McKinley Technology High School at 151 T Street Northeast. For Ward 6, Eastern High School at 1700 East Capitol Street Northeast, and Sherwood Recreation Center at 640 10th Street Northeast. For Ward 7, H.D. Woodson High School at 540 55th Street Northeast, and Kenilworth Recreation Center at 4321 Orr Street Northeast. And for Ward 8, Anacostia High School at 1601 16th Street Southeast, and Bayou High School at 3401 4th Street Southeast. In addition, to prepare residents for 2021, hashtag FitDC3 has been relaunched. FitDC3 is a citywide initiative to provide simplified health and wellness during these difficult times. The goal of hashtag FitDC3 is to strengthen every body, empower every mind, and engage every community within the district. In partnership with AITNA and executed by the DC Department of Parks and Recreation, hashtag FitDC3 will provide residents with free access to elevated health and wellness resources that support physical fitness, mental health, and stronger immune systems. This year's Fresh Start 5K Run and Walk will be the first major virtual event of the hashtag FitDC3 campaign. In Washington, Eliza Gonzalez, Manglikmot, Eagle News, we live in interesting times. Back to you, Thomas.
Up next, we have news from the business desk. And of course, our virtual roundtable. Today's topic, National Short Film Day. You're watching Eagle News America.
Yo, what's up, Happy Peeps? Kapiling nyo ba rin ang batang masunurin ng baby boy ng Happy Time? Bili na ng itlog. Pumigan na mo! Kuya, come here.
Congratulations, Mask Sunurin hosts Aiki, for winning first runner-up in the 2020 Philpop Songwriting Festival.
First runner-up from Metro Manila Cluster, Destiny by Aiki, interpreter Kevin Yadaw and Junior Crown.
See ya.
Your entry, Destiny, has indeed found its destiny in the music scene. Continue to inspire us with your brand of music. Your Happy Time family is truly proud of you.
Impormasyong mahalaga sa taong bayan. Patas na pagbabalita. Papakinggan ang magkabilang panig. Lilinawin ang mga issue at kaagad na ihahatid ng objektibo. Mata ng Agila. Tumadagit ng pinakasariwang pangyayari, hindi lamang sa loob ng bansa, kundi sa iba't ibang panig ng daigdig. Mula sa Eagle News teams at sa tulong ng makabagong teknolohiya, tiyak na makakalap kaagad ang katotohanan. Para sa mas matalas, malinaw at malalimang pagbabalita. Ito ang mas pinatalas na Mata ng Agila. Inihahatid ng veteranong broadcast journalist na si Eli Saludar. Kasama si Binibining Pilipinas Intercontinental 2019, Emma Tiglao. At pinangungunahan ng batikang mamamahayag ng bansa, Vic De Leon Lima. Mata ng Agila. Lunes hanggang Biyernes, alas 6 hanggang alas 8 ng gabi. Dito sa Net 25.
From the Business Beat, Eagle News correspondent Nicole Adeline Padilla tells us about Amazon's plans to build a fulfillment center in Louisiana.
Thank you, Thomas, and hello from Baton Rouge, Louisiana. On Tuesday, December 22, Governor John Bel Edwards and Amazon announced that the company will open its first Louisiana fulfillment center in the Lafayette Parish city of Carencro. This will create 500 direct jobs with an annual payroll of more than $16 million. Louisiana Economic Development estimates that the project will also result in 982 new indirect jobs for a total of more than 1,400 jobs. The fulfillment center will be located near the junction of Interstates 10 and 49, which will provide optimal access to Louisiana markets. In the new fulfillment center, Amazon associates will pick, pack, and ship bulky or larger sized items. Governor Edwards said this 1 million square foot fulfillment center will prove to be a tremendous asset for all of Louisiana. I am proud to welcome this new fulfillment center to Louisiana, and I look forward to Amazon's continued investment in our great state. The new fulfillment center is the latest Louisiana investment by Amazon, which already had invested more than $250 million in the state since 2010. In addition, Amazon currently operates delivery stations in Baton Rouge and in New Orleans. The company also operates an Amazon Air logistics gateway at Louis Armstrong New Orleans International Airport. In 2020, Amazon ranked Louisiana number 5 among all states for the fastest annual growth among its digital entrepreneur partners. More than 14,500 small and medium-sized businesses in the state participate in Amazon's fulfillment network. Mayor Glenn Rousseau said, "The economic impact of this facility cannot be overstated in terms of capital investment, job creation with respectable wages and benefits, and the increased interest in residential housing development." The president and CEO, Greg Gothrow of the Lafayette Economic Development Authority, said Amazon's decision to locate Louisiana's first fulfillment center here validates that our community is attractive to companies across sectors because of our work ethic, creativity, and pro-business attitude. As our economy continues to recover from impacts of the pandemic and the energy downturn, this project highlights the importance of our diversification efforts to help stabilize the region's economy. Amazon anticipates that the fulfillment center in Carencro will be completed by the end of 2021. The company will be hiring new employees 1 to 3 months prior to launching operations. I hope you are doing well there, Thomas, in Baton Rouge, Louisiana. I'm Nicole Padilla, Eagle News. We live in interesting times. Back to you, Thomas.
And thank you very much, Nicole, and I hope you're staying safe there. Well, it's time to gather ye all around the virtual roundtable, and remember to social distance. Shouldn't be too hard given our circumstances here. And what are we talking about today? Well, it's National Short Film Day. What is a short film? Why would we commemorate this? Well, the day commemorates the day that the motion picture industry was born. It was on this day way back in 1895. That's even before I was born. That's when the Lumiere brothers projected a program of short films to the public for the very, very first time. This was done at the Grand Café in Paris, France. The brothers screened these films in front of a paying audience. They actually got 33 customers to pay up to see these short films. This was the beginning of the movies. Now, these productions are also known as shorts or short subjects. I think the Oscars still call them short subjects, but in the industry, in the theater world, they're known as shorts, and they were films that were 40 minutes or less and confined to 2 reels of 35 millimeter film or less. A regular feature, incidentally, has 3 or 4 reels, sometimes 5. I remember them being shown before the actual feature film. Used to go to the movies on a Saturday when I was a kid. You'd have the feature film. Before that, you'd have, you know, a cartoon and a short and sometimes a serial. That's right. Some of the shorts were serials. And that was really smart on the part of the movie makers, because they wanted you to go back to the theater every week to see not only a new feature, but the next chapter of the theater, the next installment. And of course, some of them were cartoons, and who doesn't love cartoons? I love them. Others were comedies. One of the most famous shorts was, if you all remember, The Three Stooges, you know, pick 2. Short films were also a typical first attempt for new filmmakers. It was their first chance to get on stage because they don't cost as much to make. Amateur filmmaking, of course, has become popular as equipment has become more accessible, and you'll see all kinds of short films now up on the internet because of the low production costs. One other thing about short films, because they're so cheap to make, they cover a lot of alternative subject matter that really isn't commercially viable, and many of them cover controversial issues. So that's
Thomas,
go ahead.
Do you think Charlie Chaplin movies are short films?
Oh, absolutely. The Little Tramp. Did any of y'all see The Little Tramp? That would be a classic example of a short.
Okay.
Good old black and white movies, right?
Yeah. I'm learning a lot now because I'm not really into short films, but now I remember every time we watch Disney movies with my kids, they're always a short film before the feature movie is shown at the movies. So those are I really love those actually. And I didn't know that those are short films. Thank you for all those information you gave us, Thomas.
No, they actually filled a role, and some of them were actually very interesting. Although as a kid, it was like, come on, let's get on with a movie or a cartoon or something. But some of them were actually very interesting. Mayanne, do you recall any shorts?
Well, Thomas, I'm not very familiar with short films. Actually, I don't even realize that it's a short film that I'm watching sometimes. Well, but now that you give all the information, now I know. And just like Myla, I really enjoy also the short films that they show before every Pixar film, especially those. The ones I'm not good with titles and names, Thomas, but the ones before Toy Story films, I really love those. And recently, I got very curious about this short film called Thunder Road. It won the Grand Jury Award in the 2018 SXSW Film Festival. So I searched it, and it's only 12 minutes. I watch it, and apparently it's directed, written, and starring by one person, Jim Cummings. It was kind of weird. So
what was it about?
Well, it was like a monologue. It was like the setting was his mom's funeral. So to be honest, the analysis was like, why did this film win the award? It was weird, but I think it was the talent of the director, you know, the writer, the director, and the actor as one. But it's all about the script was just remembering his mother and delivering the speech in front of the family and friends in a funeral. And I think it is very unique.
Anna, what have you seen for shorts? What can you enlighten us with?
Well, the only one that stands to that I remember is that animated one. It was also before the I believe it was, I want to say it was Incredibles. Before that movie Incredibles in the movie theater, it was called Bow. It was animated, and I took interest in it because first of all I really loved it. I thought it was really it made me cry. I'm a crier, Thomas. I don't know what to tell you, because it was about a mom who was going through empty nest syndrome, you know? So it made me cry because I related to it. And so I looked it up, and it was the first Disney short film that was written and produced by a female. And that's why I remember it. It was good. So if you haven't seen it, look it up. It's called Bao, B-A-O.
Disney was famous for a lot of its shorts and as well as full length feature films in terms of animation, but animation basically filled a lot of the category of shorts. I don't know whether you remember Looney Tunes from Warner Brothers, Bugs Bunny. Who can forget?
Yeah. I don't even know that falls under that category.
I know, right? Yeah.
Learned so much today.
I know. I
did Sam and the chicken. Hey, look at me when I'm talking to you.
Oh, that's right.
Oh, yes. I
remember that now.
I'm going to have to go back and look all those up and bring back some good old memories.
You know, they're all up there on the internet. And actually, even the new stuff, that's where it's going now, is on the internet. You've got podcasts up there, but there's also a lot of short subjects up there as well. Anyway, we've talked a lot about short films, and you know, there's a group of people. Now, I wouldn't make a short about them at all. You'd need a full-length feature. You'd need several features. I mean, the stories they could tell. I'm talking about the folks who put their lives on the line for us, our healthcare workers, first responders, essential workers. You deserve more than a short. You deserve a feature. All of the folks out there on the front line, let's salute them with a round of applause.
Absolutely.
We appreciate you, and that's today's Eagle News America. Thank you for joining us. I'm Thomas I. Likeness, and truly, we live in interesting times.
Mga mahalagang pangyayari na naganap di lamang sa bansa, kundi maging sa iba't ibang panig ng mundo. Ating balikan sa Pilipinas 2020. Tinutukan ng Eagle News Team sa iba't ibang sulok ng bansa, pati na sa ipayong dagat. Pilipinas 2020. Hatid sa inyo ng Net25, Radyo Agila, EagleNews.ph at ng Eagle News Live. Pilipinas 2020. Abangan!
Hey there, Arnie Aquino here at Hatley Castle, one of the filming locations for the X-Men series. Don't forget to tune in to Digital Nest only on Net25.
Napakagaling mong kumanta.
I like your voice. Napaka-rare ng quality ng voice mo. Masyadong mataas, masyadong maganda.
Ito na lang masabi ko. Good luck.
Ang gagaling ninyo. Grabe yung mga pinakita nyo sa amin. Sobrang gifted kayo.
I must say, it's one of the best round na napanood ko.
It's time to sing!
It's time to eat.
Hindi nga, it's time to sing na nga.
Hindi, it's time to eat.
Kantahan nga ito kantahan to.
Kainan to.
O sige, ganito na lang. Para magkasundo tayo.
It's singing time!